Cool. Let's kick it off. Hello, thank you for joining us this morning, afternoon, evening, depending on what time it is for you, wherever you are. Welcome to this workshop on digital solutions for vaccination service delivery for COVID-19 and beyond. I'm delighted to be here with you all. My name is Amaranth Sickle, and I'm a digital health advisor with USAID Center for Innovation and Impact, which sits in the Global Health Bureau. And I'm going to pass it over to my co-presenters so that they can give their own very brief introductions, and then we'll dive in. I'll pass it over to you, Sean.
Fabulous. Thanks, Amaranth. My name is Sean Blaschke. I am a senior health specialist with UNICEF's Digital Health and Health Information System Unit. Heidi, over to you.
My name is Heidi Good. I'm Deputy Director of Social Innovation and Impact at Digital Square at PATH. Carl?
Hi, I'm Carl Leitner, a Technical Officer at DIIG.
Great. So in today's panel, we're going to be introducing you to two complementary resources that we're really excited to share. The first is the primer on digital solutions for COVID-19 vaccination service delivery, which is a resource for planners, for implementers, and for funders on how to think about digital tools to support vaccination efforts. And to help apply the content of the primer, we'll be using the quick version of the Digital Implementation Investment Guide, or the DIIG Quick Guide. And the quick guide takes the full-length DIIG, which some of you may be familiar with, and turns it kind of into a handy cheat sheet, making it much quicker and simpler to use in ways. And it's our goal that by the end of this session, everyone feel comfortable using these two resources and can think about how they could potentially support your work. So here's how the rest of the workshop is going to go. We're going to do a very quick icebreaker. Then we're going to give you a little bit of background on why we made the primer. And we're also going to talk about some of the key materials inside of it. And then we'll go into breakout rooms. Maybe we won't, we might actually just do this in one room. Focus on one use case and do a group exercise together based on the DIIG. All right. Heidi, you want to take us through to the icebreaker?
Yeah, you know what I'm wondering, since there are so few people in participating right now, I'm wondering also if we want to just maybe skip this and have everyone introduce themselves in the chat, and then we'll just jump into continuing with the primer introduction, and we'll go into the Jamboard in a bit.
Yeah, or if people even want to come off mute and introduce themselves.
Sure.
Yeah.
Okay, hi. Well, I'll go first. I'm Linda Taylor, Technical Program Manager at Digital Square.
I'll go next. My name is Abdul Basit. I'm a Technical Program Officer at Digital Square. Thank you.
Great. Joe or Akuma, would you like to introduce yourselves?
Sure. Hi, this is Joe Amlong. I am a business analyst with the Regan Street Institute, and I also work as the product owner for the Open Concept Lab terminology service.
I'm Dr. Nozaki, working for JICA as the policy advisor to the Ministry of Health in Cambodia. Nice to see you.
Is that everybody? We haven't heard from Patrick, but let's go on anyway. We're really glad you're all here, and I will pass it over to Sean.
Fabulous, thanks. So for a little bit of background on both the primer and the Digital Health Center of Excellence, which supported the development of this. This was a mechanism, a partnership that was set up in April 2021 between UNICEF, WHO, and a group of technical partners, including Digital Square Path, and donors, including USAID, World Bank, Gavi, and Global Fund. DIIG was meant during kind of the early days of the pandemic to support improved donor coordination. We noticed that a lot of funds, a lot of resources were being pumped in to supporting pandemic response, including everything from vaccine delivery to certificates. While we saw this as a great opportunity to invest in strong, resilient health systems, we also saw a risk of investments not necessarily aligned with the principles for donor alignment, didn't necessarily pick up on used tools like the DIIG, as well as other WHO best practices and guidelines. We really wanted to ensure that there was a mechanism to support more transparency, more alignment between funding streams that were coming into countries. With DIIG, really, these early stages provided some surge support through our respective regional and country teams, and focused on, again, using this as an opportunity to start to build and currently reintegrate many of the COVID-19 investments back into national systems, into routine immunization. So this guidebook, and I'm about to hand it back over to colleagues, really was meant as a easily accessible tool to support ministries of health, partners, and donors to ensure, again, that a strong process was followed from design, implementation, scale up, and handover of these COVID-19 initiatives. Thanks, back over.
Thanks, Sean. Oh, I didn't forward your slide, apologies. So the primer was built and designed around a framework that we actually adapted from the World Bank. And the framework examines the process required to get a vaccine from a port into somebody's arms. And it breaks the process down into use cases where digital solutions could add value. And in this context, when I say a use case, what I mean is an opportunity to deploy a tool to solve a problem. And what we found this framework really useful for was taking a lot of mess and making it orderly, because there are so many different ways that digital solutions could potentially support vaccination service delivery. And so the framework helped us rationalize that and give us a organized structure to think about all of those different ways. And the framework breaks down the process into 3 phases and calls out specific digital use cases that might be helpful in each phase. And there are also some that likely have utility for the entire process. So you can see those cross-cutting ones down at the bottom. So up here on the left, we have planning and management. And included in this phase is prioritization. So being able to identify and focus in on missed or vulnerable populations or other specific populations like health workers. In the planning and management phase, we also have micro-planning, or creating detailed delivery level operational plans to reach target populations. And then moving one step over to the right, we've got cold chain and supply logistics, which, as you would expect, includes supply chain and cold chain. So making sure you have what you need at the right place and that you have the ability to keep it at the right temperature. Then moving one step over, you've got service delivery over here, which encompasses pre-registration or letting people enroll in advance to get their vaccines. You've got records and decision support, which deals with solutions that can document the immunization event and also provide some form of logic-based workflow to support health workers, and certificates, which can provide verifiable evidence of vaccination status. And then down at the bottom, we have those cross-cutting use cases, which would be supportive throughout the vaccination service delivery process. So that's monitoring, which in the vaccine context involves things like using data to improve vaccine campaign quality, Also disease surveillance, tracking information about adverse events following immunization. We've got risk communication and engagement, which is about public engagement to support dissemination of information, combating misinformation, encouraging health-seeking behaviors, and overall enabling client engagement. And then finally, training and human resources for health, which is all about, training health workers, having information accessible about the location and whereabouts of your health workers, the status of your health workforce, et cetera. And one thing I'd like to point out about the framework here is that although it's flat and it can be read from left to right, like I just did, the arrows on it are actually attempting to illustrate the interrelationships between steps. So ideally, these use cases would be able to support each other in an iterative process in which, for example, monitoring information could influence where you send goods. And human resources for health information can support the way that you're thinking about prioritization or micro planning and so on. And so that's just something that I want to call out. Everything's in its nice little box here, but actually, ideally, these would all be interrelated. The primer, which will be officially launching in the new year, contains a lot of details on all of these use cases, and there are jump links within the primer that you can click on so you can breeze through and pick up what you need, and you don't actually have to flip through it from cover to cover, so to speak. So just to give you a taste, I'm going to give you a whistle-stop tour through 2 of the use cases and what kinds of information you could expect to find for the other ones. And then we'll be doing an activity based on them. So the first one we're going to zero in on is supply chain. It might be the case that there are folks here who are supply chain specialists, but just in case, really quickly, digital supply chain tools can automate things like logistics processes, and that can help provide health system managers with access to timely data that can help them make strategic decisions about procurement and supply and where what is needed. And I'm going to move really quickly here, but for each of the use cases we have in the primer, we've outlined what value you could expect to garner from using a digital tool to address that use case. You've got the requirements that you'd need for deploying the system at a very, very high level, but they're there nonetheless. And then you also have who the target users would be for the tool. And then for each of the use cases, we also have little mini case studies. So in this example, we have Cameroon, where the Open Logistics Management Information System, or Open LMIS, was used. And the ministry used Open LMIS to track vaccines, to track PPE, and all sorts of other COVID-related products. And another nice feature of this system is that it helped keep track of vaccination expiration dates, which folks here might recall wound up being a bit of a thorny issue for a lot of countries. Then finally, we have here a slide I'm not going to spend a ton of time on, but I just wanted to flag that these kinds of slides are in the primer. They give illustrative lists of tools that could potentially address each use case. And I just want to note that this isn't, us endorsing these tools. And the list definitely is not exhaustive. It's just meant to provide a good starting point so that you wouldn't have to start from scratch if you were coming into this and trying to think about what kinds of tools might be supportive for supply chain. Next, we have records and decision support. So this falls under the service delivery category on the framework. And as the name suggests, records and decision support tools can do things like document immunization records and potentially link to your ID, and also can provide job aids to support healthcare workers as they do their work. Again, here you've got all those nice details that you can click around in later. And for this, we've got an example from Rwanda, where HISP Rwanda supported the Ministry of Health to customize an immunization package. It was from DIIG, is their COVID-19 vaccine delivery toolkit. And they repurposed a whole bunch of local DIIG applications in order to develop a paperless process for vaccine management. And they were able to set up essentially an information cascade that extended from health centers through to district level and up to the national level. And the tool also was sending SMS text reminders to clients to make sure that they were going to show up for their second doses when at the second round of the vaccine. So that was pretty cool. And another cool feature was that the system integrated itself with integrated the national ID agency to be able to pull individuals' information from the national ID system as a part of an automated registration process. And when they switched to doing this automated system, as opposed to they had had a more manual process before, it actually cut down on data entry time, which was significant for them. So again, we've got a list of tools here that you could think about if you wanted some support around records or decision support. And with that, if you weren't already familiar with the idea of applying these kinds of digital tools to these use cases, now hopefully you are. And I'm going to hand it over to Carl to talk about the practical implications for implementing solutions and to tee up the breakout sessions.
Thanks. So as you're thinking about the digital health implementations, there are a number of considerations that you should keep in mind in the planning and implementation. First of all, before beginning, you really want to understand what the enabling environment is for the digital health systems. And that's going to be the focus of our breakout sessions and workshop. Oh, next, you want to identify if there's any established processes or guidance that can be utilized in your digital health implementation. These might be guidance coming from at a national level, regional, or global bodies. And as we saw in some of the previous discussion, you should also look at what are some of the existing systems that are there that you can adapt. So we'll come back to these considerations in a little bit more detail in a minute, but other things that you should engage in when you are planning your implementation is a thorough requirements gathering to ensure that you know what you're trying to do with your digital health implementation. You can also consider leveraging global goods or digital public goods, open source tools that have been proven to scale and can be rapidly deployed, and leverage data exchange and interoperability standards to reduce the burden of data entry and the reusability of data. Next slide. So looking at the enabling environment, there's a number of mHealth building blocks or digital health building blocks that you should consider. All of this is support a strong leadership and governance framework for the digital health implementations with pillars such as strategy investment, the legislation, policy, and compliance, and the workforce that help actually enact and run the digital health implementation. And those implementations, the technical aspects, rely on the services and applications, standards, interoperability, and infrastructure that's in place to actually run those applications. So as we think about the enabling environment, we want to make sure that we understand what the environment is in each of these. Next slide. For vaccination delivery and service delivery support, there are a number of processes and guidances that are already out there that you can utilize. First of all is the ICD-11 or International Classification of Diseases, which has vaccine codes, and as well as codings for various diseases, conditions, symptoms of adverse events that you can use in the classification of various aspects of the digital implementation. Next is related to certificates specifically for COVID-19. There's a WHO published a guidance document, the digital documentation of COVID-19 certificates, which provides guidance on digital systems to support both vaccination status and testing status for exchange within and across borders, continuity of care and public health security. The DDCC or digital documentation of COVID certificates is a part of a larger SMART guidelines program of work that WHO is taking on, in which we're digitizing providing reusable digital assets for WHO narrative guidance. We are shortly releasing one specifically on immunizations, including the recommended immunization schedule, which will be useful in your vaccine digital health. Next slide. Next, we want to consider the adapting and scaling. So we can do is identify the existing tools that potentially be adapted and for vaccine distribution use cases. These could be tools that are at the community, facility, district, or national level that might have some interface or with health workers and clients that are already that are involved in the vaccine delivery or utilization. And then you can also identify if there's tools that are ready, have already been deployed for emergency response and vaccine distribution, perhaps in a smaller setting, but that could be scaled nationally. And so by adapting and scaling these existing solutions, it's generally more cost effective and reduces some confusion as to what tools are doing what within the system, and reduces the duplicity. Enhances sustainability, that investments are going to establish tools are already incorporated with the health system. And as you're not building from scratch, you can more quickly. Next slide. So now we get into our breakout activity, and what we're going to do is focus in on the enabling environments and what we discussed before, including strategy and investment, infrastructure, legislation, policy, and compliance. What we want to do in the breakout sessions is think of some of the questions that you want to answer or ask, understand what the strategy investment environment is. What is the infrastructural environment? So as next slide.
I'm wondering if we want to stay in one group and talk through the different case studies together.
Yes, so we can do that. So the next slide is the, go back, sorry. There we go. So we're going to look at the two use cases that we talked about before, supply chain and the records and decision support, and look at some of the enabling factors. So let's all go to the Jamboard and we can start the activity here. So on slide, yeah, the second board, I'm going full screen. Is there a full screen option? Hopefully you can see here, we have the various enabling environment factors that we talked before: strategy and investment, infrastructure, legislation, policy, and compliance, et cetera. And then up the top on the yellow, we have a number of a few questions that we'd want to ask that help understand the enabling environment. What we'd like to do in this activity is write down some questions that you would have and then slot them into the correct place. So, for example, hopefully everybody has the Jamboard open. If we come to the first question, what are the digital health interventions that are active in this geography? Okay, so where, oops, sorry, wrong, that's my bad. Yeah, so what are the digital health interventions that are active in this geography? So where does that fit in? Is that strategy investments, infrastructure, legislation and policy, leadership and government? Where do you all think that this would fit in? Perhaps under services and applications? We're trying to understand what specific applications have been deployed and where they deployed, so we have a better sense of planning.
I also think it can go into a few other factors as well. And when you're looking at, let's say, strategy and investments, you want to see what already exists, so it prevents duplicity of investment. And it can also possibly go under standards and interoperability, because at that point you want to consider how you link different tools that are in place.
So there's what digital health applications exist in the roadmap and strategy. And then what standards are being used by those digital health applications. And please feel free to create questions and add them into the appropriate category or where you think we should go.
If anyone's uncomfortable using the Jamboard, please feel free to also just type it into the chat and then we can drop it in for you. Or come off mute and share your contribution.
So what about the question that's here? Does the supply chain tool link to the master facility list? Where would that? Any suggestions on where to put that?
Definitely interoperability.
And maybe there's a question, is there a master facility list?
Yeah, good point. And that could also be part of the strategy itself. Right? Like if there's a digital health strategy, and does that take into account linking the supply chain tool with the master facility list? At what point you do that in the roadmap?
So maybe under the services and applications is ask, is there a master facility list? And then are there plans for a master facility list? Goes into your strategy.
Are these just a set of illustrative questions that have been filled in and we can talk about more points?
Yes. Are there other things that you would like to understand before thinking about your digital health deployment? What about around workforce or leadership and governance? Or health content? See somebody put capacity building and training. I suspect that's going to go into the workforce. Yeah. See, there's also, is there a national policy on HIE standards? That's great. Question policy. Their national infrastructure in place to support digital health intervention effectively. Good infrastructure question. There's supervisory support services. Is there a dedicated workforce to implement? Is there a product catalog or master list? I'm going to put that under health content. This is for supply chain. It's a good question. What about barcodes? Are they used for vaccination or for vaccine supply? Perhaps both under standards and operability, and is there a requirement in place to use barcodes? Could be a policy question. somebody said it. Has appropriate stakeholders been identified, and is there already a structure for how they should work together? Data protection laws. If we've got a good sense of some of the questions that we want to ask in thinking through supply chain and enabling environments for digital systems. Maybe we can move to the next Jamboard on records and decision support. So we've got a few questions at the top already set for you. What digital health interventions are active in this geography? So where do we say that goes? A couple different places, right? It's a similar question, but applies. What is the digital literacy of the workforce that will use the tool? Where does that go? Great. That's workforce. And feel free to add your own questions. Are there relevant policies for unique IDs and identity management for client patients? Great. Has a vaccination schedule been set? Health content. Is patient data stored, managed in another platform? Is there strategy or standards to support interoperability? That's an interoperability question, or it's also a policy question, right? If there are no standards for interoperability, how do you know which ones to use? With the relevant policies for unique IDs, there's probably, if there is a relevant policy, there might also be a service that's related to that. As we saw in heard about in the example for Rwanda. Is there a client registry, EMR, shared health record? Does it utilize national standards? I suggest maybe putting that one under the services and applications and/or standards and interoperability. It's a little bit less about the health content. Health content would be specific for the vaccine delivery. Is there a national health data dictionary? That's a great one. And maybe related to that, is there a service for the data dictionary? Assuming that it exists, and then does that service actually use a standard for sharing out that data? See, there are multiple facets of a simple question. Is there an existing EIR, and if so, is it comprehensive for routine vaccination and COVID-19? Good infrastructure question. Anybody want to highlight one of the questions that they put on, or is there a national process to align digital health interventions? Is it operational and a mechanism for compliance? That's a good leadership and governance question. Is there a strategy or a roadmap for EMRs? Might be a question to ask as you think through vaccine-specific solution. Is there a long-term strategy to support the maintenance and the digital system? Is there an underlying community health strategy to define the expected capabilities and workflows in the digital applications? Capacity to support the tool within the Ministry of Health in short and long term? Workforce question. Any reflections from you all on some of the questions, maybe comparing between the supply chain and decision support? Same set of questions, are there differences in how you think about this based on the intervention? Is there a need and mechanisms to provide continuous training? So is that question about, is there like a training platform in the infrastructure question, or is it also a workforce question? I think maybe it's a little bit of both, right? Great. I think we're winding down from this. We've got a number of great questions here that we would want to ask as we consider these types of digital health interventions, and a number of them I think are similar when we went from the supply chain to records and decision support, and then some that are unique. Questions around patient data, patient IDs are probably more relevant on the records and decision support, and less relevant on sort of the supply chain issues. Specific knowledge about health content and vaccination schedules are more important than records and decision support, but also perhaps useful in the supply chain when thinking about planning and for the vaccine supply. So maybe we can come back to the main room.
I feel like since we didn't wind up going into two separate rooms, there's no sharing part. So maybe I'll just pass it over to you, Heidi, to close this out.
Sure. I was just dropping a link again in the chat for those who maybe joined right after we started to make sure you still had it visible. So the sheet we were working from is part of the Digital Health Investment Quick Guide, which is published on the WHO site. And you can find that and a lot of other tools in the DIIG, as well as in the draft version of the COVID primer, which we were discussing. So I just want to have those links in there for you as well. We really appreciate your participation today, this evening, this morning, whatever time zone you're in right now. And we wanted to share this form if If you are working on adapting tools for COVID-19 or post-pandemic response, we're really interested in collecting and hearing from you about what that process has been like, what that use case is, so that we can learn more about what these adaptation use cases are and share them out with others. So the form, if you're interested, just can give us your contact information and let us know more about what you're working on. So please feel free to click on that and share back with us if you'd like us to be in touch. That's it. Thank you everyone for your time today. We have some time for questions. So if anyone has questions, we can leave the floor open for a few minutes.
Not really a question, just wanted to say thank you so much that this is directly relevant to something I'm working on currently. So this has been really helpful.
Nice to hear. Thank you, Linda. All right, well, if there are no other questions, we'll let everyone go to their next session. Thank you so much for joining us today.
Thank you, everybody. Have a good night, good day, good night.
Thanks all. Good morning.